local healthcare networks trying a new way to help patients living with asthma. Part of the approach is to reduce medical emergencies by controlling asthma triggers in the home. To tell us about the program is our guest from Boston Medical Center HealthNet Plan, the Manager of Care Management, Marie Javorski. Thank you very much for being with us, Marie.
Thank you for having me.
First of all, when it comes to emergency trips to the hospital, how big a deal is asthma?
It's fairly significant. There are a lot of people that will seek care in the emergency department or have urgent visits with their primary care physicians. And they do utilize that source quite often.
Well, one of the things that I guess you've learned over the years is that you can't cure asthma necessarily, but on the other hand, you can change the number of times you have a crisis.
You can definitely control asthma. There are many things that play into asthma. There are a lot of triggers, and the more that people can manage their triggers, the more successful they are with managing the condition.
What are the main problems with management? Is it the environmental triggers, or maybe just even keeping track of medications and taking them the way they're supposed to be taken?
Both are really, really important. Managing the triggers, a lot of triggers in the home, a lot of environmental allergens need to be paid attention to, and then keeping your course of medications and staying on track, communicating with your provider is all very, very important.
Now, I'm sure you probably hear about a lot of people who do a lot of house cleaning, and yet I guess they could still have some asthma triggers around.
Absolutely. Sometimes it's even the cleaning products that are being used in the home. But there's allergens in the home from pet danders, dust mites, the cleaning products, molds, all sorts of things.
Maybe even insects in the house too?
Insects in the house, sometimes pests, rodents and insects can play a part in the asthma trigger.
So how does your program help people deal with these things? Because they need someone who can take them by the hand sometimes and show them what's got to be done.
Yes. We have a program at Boston Medical Center HealthNet Plan where we'll have a community health worker come into the home for our members that have asthma. If they'd like us to come into the home, we'll come in and we'll do an Environmental Protection Agency assessment for triggers in the home. And we'll talk to the family about molds, about their pets, about dust mites, and things that may be triggering flare-ups in their asthma. We'll also give them information to have some of those things mitigated if there are things in the home such as water damage and mold.
Now, what about the medications? Because a lot of the time we're talking about young children with asthma, and if the children can't keep track of this, you've got a busy parent who's going to have a challenge too. So how do you work around that?
A lot of it is education, and we also work with the members with what we call My Medication List. And we write down the medications that the parent or the child are taking, and we go over the schedule with them and make sure that they are keeping to the schedule that their doctor has suggested. And if they're not, our nurses can work with them to work with their providers to make sure that they're removing any barriers, and we help them get to their appointments. So that medication list helps.
Well, this is still a fairly new program, but I guess you're going the same way as some other programs around the country. Do we know much about how much of a difference this makes?
Our program is very young in its infancy, but there are programs across the country that have had great success. We know of programs in Colorado and Maryland that have had really nice success with their programs, and we feel it's really important. We find with the community health workers going into the home, there's better compliance, there's better access to care. It benefits the patient, it benefits the provider.
Now, of course, it's great if you don't have to take a child to the hospital so often, but I guess what else could be happening here is the child doesn't miss school as often, the parent doesn't have to take time off work as much, so there are some gains.
Yes, absolutely. The school nurses are very involved in the asthma program here in Massachusetts, and it's nice to be able to be part of the whole picture.
Well, if people would like some more information about this, is there some place online where they can find that?
Yes, they can go on to www.bmchp.org.